Yeah, ladies and gentlemen, this is a Nasco Talk Show International, celebrity talkative number one, you know what I'm saying? So, NCLEX-RN, the computer shut off at 85 questions. 85 questions. Yay! The longest 45 hours of my life. The longest 45 hours of my life. So, guys, first of all, Tommy, congratulations. So, I passed my NCLEX. I passed NCLEX. I passed at 85 questions. Okay, so the reason for this video right now is to encourage some of you. I know that there are a lot of videos up there about NCLEX, about what happens when your computer shuts off at 85 questions, what happens if you go beyond 85. The computer can shut off at any time. 75 questions, 85 questions. You can shut off at 100 questions. You can go all the way to the maximum of 150 questions that the NCLEX-RN have. So that doesn't mean that you fail. This is a computer adaptation, exam. So the questions adapt as you go. You get some easy ones and then get hard. When they determine that you have reached the 95 percentage, the system will shut off. So you can pass, you can lose. But that's not what I want to talk about. I want to talk about how long it is for those of you who take it and you're so curious, because of course, the night before my exam, I didn't sleep. I couldn't sleep. I was having palpitation. My heart blood pressure was so high. I couldn't sleep at all because I was so nervous. Because this is the biggest thing of my life, of my career. So I couldn't sleep. On the day of the exam, I dressed up. I was driving. As I was driving to my exam center, I was praying because I'm a very prayerful person, even though I'm a sinner. So I keep praying and everything. So after taking the exam, I came out. I don't know what NCLEX is looking at. To be honest with you, I don't know what they're looking at because all the questions, all the options are correct. All the options are correct. I guess they're looking for the best of the answers, especially when it comes to the priority questions. So when you do your elimination method, you narrow it down to two. Enough of that, blah, 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 blah. Let's talk about the most important thing. So shout out to Los Angeles City College. That is where I graduated from the RN program. And then shout out to Archer. Special thanks to Archer. So this is not a paid promotion. Archer did not pay me to promote them, but I used Archer. I used Archer to prepare. And I want to encourage you guys, irrespective of the NCLEX preparation package that you're using, but I think that the most important thing is the consistency and how you're doing and what do you think that you're getting so far. So I used Archer, and Archer has over 3,000 questions back, including the NGN, multiple choice, and SATA. I used everything. Yes, my Archer is empty. I used everything a day before my exam. Yes, I used everything a day before my exam. All the 3,000, over 3,000 questions, I used them. But that is not the point that I'm trying to make. The point I'm trying to make right here is that now you know how Archer is, right? The reason why I'm calling Archer is because that is the NCLEX preparation package that I used. So I don't know about others, but for those of you who used Archer, this is what I got to tell you. Let me advise you a little bit. So Archer have this tutorial section, and they have the CAT, which is the CAT, and then they have readiness assessment. So Archer told you that when you do the CAT, do not base your judgment on one pass on the CAT. And then they tell you that for you to be sure that you should do the readiness assessment. So the readiness assessments, the readiness assessment have from fail, borderline, high, and very high. So they tell you that the moment that you go 4 straight high to very high on your readiness assessment, and you are ready, that you should go take your exam. So let me tell you, When I did my baseline assessment, I scored 52%. And I was so demoralized. And that was borderline. That was borderline. I was so demoralized. I was like, no, I'm not ready. Because it took me 3 months to prepare for this exam. The reason was because, I have a family, I have to go back to work, I have to go back to full-time job. Because when I was working, when I was in school, I was doing just one day. I work only once in a week so I can focus in school. But then after school, I have to go back to work. So I dedicate a little hours to study. So I took that whole 3 months to study for this exam. So when I took my baseline assessment in Archer, I scored 52%, which was in the baseline assessment. So, but then I was discouraged for sure. So then I started studying. So when I study, I go from baseline, then I got high and high, then back to baseline, then I go to high. Then I never got to that, four straight highs or very highs. I never got to 4 straight highs or very highs. It's been high, borderline, high, borderline, high, until then, the last week to when I scheduled my NCLEX, and then I got a high, very high, and then I was like, yeah, okay, I think I'm ready right now. You know what I mean? So, but then I was doing CAT. When I was doing CAT, because each time I got demoralized when I got borderline on the readiness assessment, I would go back and do CAT. I've done like 8 streaks of CAT and I always pass. So even when I get 52 on CAT will still tell me that I passed. But when I get 52 on readiness assessment will tell me that I'm on the borderline. So I gotta be comparing this. So I'm trying to tell you, if you're using Archer, I'm not gonna tell you that, okay, be scoring 52, right? Because towards the last 3 weeks of my preparation, my score improved so well. And I'm going to tell you this secret. So when you do some of these questions back in Archer, do not take too long to go and revisit the questions that you failed. And when you want to do them, set it in tutorial. That way, when you try them again and fail, you can read the rationales. So read the rationales to see what they are talking about. Try to connect the dots. So when you narrow down the questions that you missed to about 50, 10, then you go do CAT. Do 2 to 3 CAT and see where your score is. And then you do the tutorial and then you do the readiness assessment. That will improve your score. So my score began to increase from 52% to about 59 to 60 to until I got to about 70, 79. Then I said, okay, I think I'm ready. But then I went for the NCLEX. I took it. The questions were not friendly at all. That has been the longest 48 hours of my life. When I wake up in the morning, I check. When I wake up, I check. When I want to go use the restroom, I will check. I will go to board of registered nurse. Even the Pearson view, trick doesn't work. When I put in my name, trying to register again, it allowed me to register. It allowed me to put in my information, to allow me to put in my credit card or debit card to pay. And I was like, did I really fail? But 48 hours after that, I went to where it will tell you that the result is ready. They want you to pay $7 to find out. I didn't want to pay. I went straight to the board of registered nurse and I typed in my name and I saw my name with my license. Yay! Finally, a licensed RN nurse. Thank you, Archer. Thank you, Archer. Thank you, Archer. You're the best. Thank you so much. I'm so excited. Come on, feel free to reach out and ask any questions in case you are anticipating your NCLEX-RN question. Feel free to ask me any questions. Put it in the comment section and I will be right here to help you. I want to encourage you. You can do it. If I can do it, you can do it too. Thank you so much. I'm a Nurse Good Talk Show International Celebrity Talk. Number 1, you know what I'm saying?